hydration is such a critical component. It's one of the most overlooked things, especially when it comes to GLP-1s. So one of the things that people don't realize with GLP-1s is it decreases thirst perception and it decreases drinking water behavior. Now, when it comes to extracellular water and intracellular water, I actually started looking at these reports to understand more about intracellular water because the volume of the cell has so much control when it comes to metabolism. When the cell volume is increased, it's more of an anabolic signal. You're actually protecting against protein degradation. Where if you had more extracellular water or you had a shrinking of the cell, you actually are causing protein degradation now. And so this is one of the reasons that a lot of patients lose muscle on GLP-1s. It's not the GLP-1 itself. The GLP-1 is actually beneficial to muscle. It has to do with, of course, protein intake, but also the hydration state that has metabolic control.
Welcome to Beyond the Scale. I'm your host, Bradley Davie. This podcast exists to empower and educate the next generation of healthcare providers. We're here to share tips, tricks, tools, and resources to help catalyze your growth with InBody's ecosystem of healthcare assessment tools. Today, we're going to talk about how body composition is applied in integrative medicine and many different modalities of therapy. Our guest today is Dr. Leonard Pastrana. Dr. Pastrana is a pharmacist and co-founder of nuBioAge, where he focuses on cellular medicine and longevity optimization. Beyond nuBioAge, he is a key figure in the integrative medicine community, pioneering peptide-enhancing supplements and leading the way in clinical application of longevity medicine and metabolic breath analysis. Welcome, Dr. Pastrana. Thank you for joining us.
Thank you. Glad to be here. Excited to have this conversation.
Well, tell me a little bit about where you came from and your philosophy of care that you've developed today.
Sure. So I am a pharmacist. My experience was in, your typical retail pharmacy, working at, big chain pharmacy, which I did for way too long. Didn't enjoy that too much. I enjoyed patient interaction, but I didn't enjoy, just being on it felt like a factory line of just pumping, medications out. And so I enjoyed more of the clinical aspect of pharmacy. So I moved over to hospital. And I enjoyed that a lot more, but still, I didn't feel like I was making that big of an impact. And I noticed my health was also, declining just as the patients I saw walking into the hospital. And so I left, I would say traditional medicine to pursue other things and entrepreneurship. And one of the main things that I realized between some of the people that I looked up to was that they had a really good handle on their health. They really focused on optimizing their own health so that they can optimize their businesses and just be just more efficient or more impactful. And that's when I went on my own kind of health journey. Losing a lot of weight. I was very much overweight. And in the middle of that, I ran into certain physicians and certain medical practitioners that looked at medicine completely different from what I was traditionally trained in. And they incorporated exercise, they incorporated nutrition, they incorporated very unique compounds like things like peptide therapy and other medications in conjunction to create these complete treatment protocols. Very knowledgeable physicians, especially when it came into the biochemistry of why things were working. And I was fascinated by that. And then so I started going to different conferences and certifications and understanding how these molecules were working. And just kind of fell in love with it and decided, this is what I want to do for the rest of my life. I can take my background in pharmacy and background and how the body works and compounds and utilize things like peptides and the science behind exercise and how we can prescribe exercise. And this is something I can focus on for the rest of my life. And so that's how I came to this point where it's a pretty untraditional role for a pharmacist, but that's how we started nuBioAge, which was really the focus of that was, bridging the gap between research and how physicians or medical practitioners were treating their patients, not just with the compounds, but utilizing other diagnostic devices to really get personalized when it comes to what compounds, what exercise you can actually prescribe to a patient to really get the best outcomes. And it's been a lot of fun. It's a lot of fun to just the people that you hang out with, the people that you run into, the companies you run into. It's just so much more exciting than my first jobs in pharmacy, for sure.
Can you take me through perhaps what it looks like for a new patient to come to you? What kind of things are you trying to learn about them, and data are you trying to get to help understand their path forward?
Sure. So there's a lot of different ways that we come across either a patient or a physician in our ecosystem. One of the things that we do is we have longevity assessment labs where a lot of physicians send their patients over to our assessment lab where we do body composition screening, we do metabolic breath analysis, blood biomarkers, and helping the patients kind of understand what all these data points mean. Where we spend most of our time is actually educating the practitioners. So nuBioAge does a lot of education, certification courses, and helping physicians or medical practitioners understand the different compounds that are available to them and how they can utilize them in conjunction with supplements and other things to, the ultimate goal for all of us is just to get the best outcomes for the patient. So depending on, which one of those scenarios I'm in, if we're doing any type of coaching or collaborative practice with other physicians, one of the first things that they know when they come to us is that they're going to get, an assessment that's a little bit different from what they're used to. Not only are we looking at blood biomarkers, but we're looking at family history. We're looking at metabolic breath analysis, which is basically measuring how well they utilize oxygen, measuring their VO2 max, their cardiorespiratory fitness, a lot of other biomarkers that we can gain from understanding their metabolism in conjunction with body composition, which we feel like is the baseline of where we start, because body composition tells us so much. And really, when we sit down with the patient, it's not just giving them all these biomarkers, but explaining to them what they need in conjunction with each other. And from that and their goals, then we can come up with a plan. If that's lifestyle modifications, if that's compounds, if it's supplements, we come up with a plan together to help them reach their goals a lot faster.
Weight loss and body composition, I think it's been gaining in popularity. For a while, it was more about just weight, but I feel like health span or longevity or quality of people's lives seem to be becoming more important these days. Why do you think something like that's been happening?
Well, it's a really interesting question, and I think there's a lot of dynamics to it. I happen to think that COVID really made a big difference in the way people thought about their health. They got a lot of information from people they trusted that didn't seem to be true at the end of the day, and they started for the first time actually questioning the status quo of who's actually incentivized to keep me healthy out here, and started questioning things. And so outside of your typical, hey, I just want to lose some pounds on the scale, they started thinking about, well, should I be losing muscle mass at the same time? Should I be worrying about my cardiorespiratory fitness? Should I be looking at biomarkers? And they started, really engaging in their own healthcare in a way that they never had before. I think COVID actually brought that to light, because they started seeing who was having the worst outcomes when it came to COVID. Was it people that were smoking? Was it people that were overweight? Was it people that had other chronic disease states? What was it about people in general? Because of course there's always offshoots that made certain people more resilient to a viral infection than others. And people started realizing, not only do I not need to be sick, but I need to start actually optimizing myself so that if anything comes my way, I can be resilient towards that. And not only physicians, but patients started realizing, hey, I don't want to wait till I have that chronic disease state. I want to know what's my risk for that chronic disease state now, and how can I start intervening now, 5, 10, 15 years before I actually even get there. And so they went out looking for people that were actually thinking about this and actually talking about that. And so, that in conjunction with this blockbuster drug and GLP-1s coming out that's helping everybody lose weight is where I think everybody is like, changing the way they think about their own health and think about just who to trust in health in general. And it's, if someone's just telling them to just lose weight, now it's a red flag for them. There's more to weight loss. It's more about body composition, which is why InBody is just such a critical device when it comes to the future of medicine, especially when it comes to longevity and health span and lifespan.
Yeah, it's such a great way to identify possible disease states, or monitor the reversal of people's metabolic health if it's poor. You have an InBody in your clinic. Which model do you have, and then how How is it set up in there? What's the experience like when somebody comes through to do the test?
Sure, we have the InBody 570, and it is, what we love about the InBody, and we love about body composition in general, is that this is the best conversation starter for someone's overall metabolic health that we can have. We have it set up in there. It's just baked into the price of any type of program that we have. People can come in and use it as frequently or infrequently as they want, but this is where the conversation begins when it comes to metabolism, because when it comes to an InBody, it's not just of how am I doing? Am I doing better? One of the things we do is we use it to recognize if the treatments that they're recommending are actually making a difference. But one of the things that we teach physicians is that body composition, the way that you treat body composition or longevity or weight loss is different when you're inducing weight loss and when you're maintaining weight loss. So the treatment plan might be completely different. And so the data that we get from like for an InBody when it comes to body composition is first going to clue us into what type of exercise is necessary, what type of nutrition is necessary when it comes to protein intake. But that's just when we initiate therapy. Then as the patient's changing, as their body composition is changing, as their health is changing, so does the treatment plan, because now there's different things happening and we might want to pivot what type of exercise, what type of compounds we're using, what type of nutrition, because someone might have adequate muscle mass when they start and they're losing weight rapidly. And now that's changing. So now we have to change our treatment plan and our recommendations when it comes to nutrition. And the only way to do that is to be utilizing something like an InBody frequently when the patient's coming in for follow-ups.
Can you talk more about that then in terms of like what kind of markers are you looking for to help identify those changes that might be indicated in their plan?
Yeah, absolutely. So we know that, for instance, if someone's losing weight loss with or without a medication, when you have rapid weight loss, you can potentially lose muscle mass. So we're keeping a close eye on fat tissue and muscle mass. And also looking at body fat percentage, because that's an easy way to tell if your body fat percentage stays the same while you're losing weight. Well, it means you're losing fat tissue and muscle, and you're not making necessarily as big a difference as you think you are. The other main thing that we look at is the visceral fat score, or the visceral fat component, because visceral fat is going to tell us so much more when it comes to actually some of the compounds that we can utilize and identifying risk in patients. So when you look at the studies when it comes to mortality risk, when it comes to visceral fat, the one thing that we're looking at in longevity is, the one aspect of longevity, it's health span, but it's also lifespan. So mortality risk, how long someone's going to live. And so if you look at the 3 common disease states that are the biggest killers are neurodegenerative disease, cardiovascular disease, and cancer, these are some of the things that we want to identify risk in. And when you look at the studies and you look at the literature, visceral fat you can see all the studies when it comes to the connection with visceral fat and Alzheimer's disease. When it comes to the increase in visceral fat and cardiovascular disease, or the increase in visceral fat when it comes to cancer, just even inflammatory markers. There's studies showing that as inflammatory markers like C-reactive protein increase, so does visceral fat. And if you corrected for visceral fat, you actually wouldn't see that low-grade inflammation. And so visceral fat is something that we pay very close attention to, because it's not just metabolism, it's not just body composition, but that increase in visceral fat actually secretes these inflammatory cytokines that play an important role in autoimmune disease, immune dysregulation, gut dysbiosis. And so when patients come in and they have these other issues and we see an increase in things like visceral fat, we know that when we can decrease that visceral fat, it's actually going to play a role in some of the other disease states that are kind of complicating their health goals. And so this is something we pay very close attention to. It's probably one of the main things that we're looking at in decreasing. And the good thing about it is that we have a lot of literature talking about different compounds and different things that we can do to make an impact on visceral fat. So I would say, fat tissue, specifically what fat tissue, subcutaneous versus visceral fat, is the first thing that we're looking at, because a lot of people, and you never know. This is the big thing, is that you never know. Someone might come in and they might have a lot of subcutaneous fat, and you would guess that they'd have high visceral fat, but they don't. Same thing happens on the opposite side. You have someone that's a little bit thinner, and they have a high level of visceral fat, which you would never recognize if you were doing traditional ways of measuring somebody's, like, let's say their BMI. You're going to miss a lot of things if you're looking at BMI. You're going to miss that one patient that's extremely dangerous that has a high amount of subcutaneous fat and a low amount of muscle. So they're like skinny fat. It's like normal weight obesity. And see, these are some of the patients that can be in the most amount of danger because they're being overlooked by their traditional, physician that's just looking at BMI, right? Same thing on the other opposite end, right? I have a friend that has a BMI of 30. So he's technically obese, but he's got 14% body fat. He's got amazing cardiorespiratory fitness. He lifts a lot of weights and has a lot of muscle on him. So am I going to make clinical decisions or decisions based on medications on his BMI alone? No, of course not. You have to look at body composition, and it's critical for everybody moving forward if you want to make the right decisions.
Do you think there's anything that leads to somebody having more subcutaneous fat versus more visceral fat, and what would create that differentiation?
What I've noticed is you can guess, you can kind of get a sense of when someone walks in what you're going to find, but you really never know until you take a look. That one's hard to tell. I think that there are some genetic components to it, but I wouldn't say that I've been able to nail down any type of trend as to why that might be the case. Metabolism is so tricky when it comes to insulin dynamics, glucose dynamics, the way people store fat, just even genetically or ethnic wise, there's certain ethnic populations that store fat in different locations. And this is another thing that we're looking at is the location of the fat to identify certain risk factors, right? So we know that abdominal fat compared to hip fat is going to make a big difference, even in things like prostate cancer and pancreatic cancer. And so it's really hard to nail down, why that's happening specifically in any one case. I don't think you can nail it down to any one thing. There's a lot of things that factor into something like that.
So I heard pretty early on you got excited about all these different peptides, and I was curious, what did you recognize at that point that really got you excited about it?
Sure. So coming from a pharmacist background, I was so used to medications that, someone came in, they had diabetes, they had hypertension. Here's your medication. This is what you got to take for the rest of your life. We're not necessarily making you better, but we're kind of managing you while this disease state you have slowly kind of progresses. But maybe we can slow down its progression. And that's what I was used to. And that's the world kind of I was trained in. And when I came to this community that was studying peptides and peptide therapy, it was a completely different conversation. What I loved about peptides was that they weren't these forever compounds that you needed to take, and they had this modulating effect. So in traditional pharmacy, you understand the mechanism of action of a drug, what receptor it's binding to, it binds that receptor and elicits all these responses. Where when I was looking at, pharmacist thinking wise, the mechanism of action of peptides, they had this modulating effect, right? Where it didn't necessarily just create, one action that had all these other downstream cascade effects. They had cascade effects, but in a pleiotropic way, where the perfect example is, like, let me just give you an example of what modulating effects instead of trying to describe it. So for instance, like a GLP-1. So a GLP-1 secretes insulin to bring glucose down, right? So that's one of its actions, one of the many actions it has. Well, this is kind of counterintuitive. If people have really high insulin levels, it causes hyperinsulinemia that can cause diabetes. So why would we want to take a peptide that's going to secrete insulin? Well, it's because it's got a modulating effect. It does it at the exact time that you want it to happen. So after you eat, glucose goes up, and this is when it secretes insulin in response to high glucose. So exactly at the moment you want insulin to be secreted and bring glucose into the cell so it's not in the bloodstream is how it does that. And so that's one example. Another example is with growth hormone secretagogues, right? So as we age, we secrete less growth hormone, right? There's what you can just give growth hormone, but that's not the way the body naturally makes it, right? The body naturally pulses out growth hormone. And so as we age, we pulse out less and less growth hormone. So a growth hormone peptide actually stimulates your pituitary gland to pulse out its own growth hormone the way it does. So it has this modulating effect. And I found that fascinating because it was going to help us, improve people's metabolism, use things for the short term while we included exercise, while we included nutrition. And it kind of leverages the intelligence of the cell so that your body can do what it was meant to do the whole time. And so this was, to me, like a brand new concept. And what I loved was like how well you had to combine it with lifestyle modifications and exercise to really, get the best results. And so this is kind of where I was like, well, this is what I want to focus on. I want to study this from now on because I can think it can make the biggest impact on changing people's lives and getting them back to the way they were feeling when they were younger. And that's not something I saw in traditional medicine.
It makes me think of like there's a whole wave of AI technology happening outside the world and computers and things like that. And it really feels like this might be AI or like artificial intelligence within the cells that is also emerging similarly at the same time.
Yeah, that's a great example. And one of the things that we did when we were studying this is that you have to understand biochemistry and how the cell works. And we weren't studying how to overpower the cell or trick the cell to do anything. Some of the best practitioners and scientists when it comes to peptide therapy, what they're focusing on is what the cell does in its most efficient state. And can we leverage that intelligence? So can we mimic what the cell is already intelligently knows how to do, right? So one of the big misconceptions is that something goes wrong or something gets dysfunctional. Well, no, it's just the cell is trying to overcompensate to fix something else that it is being attacked by. And in that process of fixing something else, this is where this dysregulation happens. And the beautiful thing about peptides is that we can leverage the intelligence of that cell. And that's getting to like the very, cellular component. But what we're really talking about here is metabolism. We're talking about, fat tissue and muscle and the ability to, improve your metabolism and how well your body, gets rid of glucose. And basically we're trying to mimic how our bodies acted in our 20s is what we're trying to do. And, the great thing about medicine in this day and age is that we have so many amazing tools, not only to help do that, but now to measure what is going wrong, for instance, when it comes to body composition. And so you can see something going wrong when it comes to chronic disease in body composition 10, 15 years before it shows up on a blood panel, right? Because it is that body composition and that biochemistry that's changing. And you have a lack of muscle or an abundance of fat tissue that's secreting inflammatory cytokines that can cause bad metabolism, or you have a smaller amount of muscle that's so important in glucose and carbohydrate metabolism. And so we can catch that so much earlier than by the time it gets completely dysregulated and now it's showing up on a blood panel and now you're kind of already pre-diabetic, which is okay. We can still make big changes there, but most people want to make those changes earlier on in life.
So water makes up about 73% of your lean mass, and some of that's inside the cells of your bones and muscles, and the other side of it is outside in your blood and your skin and your lymphatic system. And on the InBody, we actually show a ratio of extracellular water within the total water. And we're looking at what percentage of that water is outside the cells. And over time, that changes because water and nutrients are moving in and out of the cells. And that score, a pharmacist from Oklahoma, Dr. Kathy Campbell, taught me that she looks at that ECW, TBW score as kind of an indication of somebody's metabolic efficiency over time. Can you explain a little bit more about that, how you see that water shift changing and how you look at that in your practice?
Sure. So you made me thirsty when you started talking about water. That's why I had to pick up my water.
Sure.
But no, absolutely. Hydration is such a critical component. It's actually one of the things that we focus on as a company because it's one of the most overlooked things, especially when it comes to GLP-1s. So one of the things that people don't realize with GLP-1s is it decreases thirst perception and it decreases drinking water behavior. Right. So they studied it in patients that overconsume fluids, a disease called primary polydipsia, and actually GLP-1s decrease the amount of fluid that they drank. Now, when it comes to extracellular water and intracellular water, this is true. And I actually started looking at these reports to understand more about intracellular water, because when you have an increase in intracellular water, the volume of the cell has so much control when it comes to metabolism. So looking at increases in intracellular water or an increased volume of the actual cell compared to extracellular water has a ton of metabolic control. So when the cell volume is increased, you actually are protecting against, it's a more of an anabolic signal. You're actually protecting against protein degradation, where if you had more extracellular water or you had a shrinking of the cell, you actually are causing protein degradation now. And so this is one of the reasons that a lot of patients lose muscle on GLP-1s. It's not the GLP-1 itself. The GLP-1 is actually beneficial to muscle. It has to do with, of course, protein intake, but also the hydration state that causes has metabolic control. And so this is actually one of the things that we helped formulate with another organization in specific amino acids that act as osmolytes that draw water into the cell, because we want to increase intracellular water. One, to protect against protein degradation, but a lot of our practitioners are using it in things like aesthetic, like the impact on the skin, and the most utilization that we see is in athletes, right? So there's a lot of studies showing that in athletes, if you can increase intracellular water, you can improve strength and performance. And they looked at this in athletes over an entire season. They looked at it from workout to workout. Those athletes with an increase in intracellular water performed a lot better. And so this is something that we use in a lot of the GLP-1 patients, where we're making sure that they're hydrated using specific amino acids to make sure that their volume is good so that they can exercise better. And then they also looked at this in elderly patients as well. So when it comes to like frailty and performance, elderly patients seem to get dehydrated a lot easier. They drink less fluid. But yeah, hydration is probably the most overlooked component. And so once we realized that, we went back to all of our old reports, and it's really hard to look at, cellular water, because water is coming in and out of the cell, continuously. So we noticed that our patients that were more metabolically unstable had, smaller intracellular water, but it was like minimal. It's like 1 to 2%. If you make a change from 1 to 2% when it comes to cell volume, it's actually a big difference, because our bodies are constantly trying to get back to homeostasis. But we definitely saw the trend there. And so, yes, intracellular water and hydration plays a tremendous impact on everything that we're doing when it comes to patient outcomes.
What's the supplement called that you're helping with the hydration?
Sure, it's called iCell water. And what we did there, we actually did this before we put that together. What we were doing in athletes, and with a lot of the physicians that we worked for were doing in athletes, they were getting specific amino acids like glycine, glutamine, alanine. These are amino acid osmolytes, meaning that they draw water into the cell. Creatine is another one that is an osmolyte that draws water into the cell. And they were using all these amino acids and putting it in their, big jug of water all day. And they were drinking it slowly throughout the day to stay hydrated, especially in the high performing athletes, because they're burning so many calories. We wanted to protect their muscle. Didn't want them losing any muscle. But then it was just, when we try to do it with patients, they're not going to buy 5 or 6 different amino acids and put it in their water every day. And so that's when, we were asked to help create iCell water, which is, all these amino acid osmolytes plus creatine. And they put 1 scoop of that in 2 liters of water, and they drink it slowly throughout the day. So it's not a hydration drink that you drink all in one shot. It's so that you can slowly drink water throughout the day. So the recommendation for a lot of physicians have is to drink anywhere from 2 to 4 liters of water per day, depending on how much you're exercising. And so this way we have the amino acids in there, we have the creatine in there. They drink it slowly throughout the day. It improves and enhances their performance in exercise. Make sure they're hydrated. And for our patients on GLP-1, where we're trying to maintain muscle mass, it helps them maintain that muscle mass because of the volume of the cell, and protects against protein degradation. So one of our greatest tools is improving protein intake, making sure they're hydrated. We have patients all the time losing a ton of weight while maintaining mass. And for people on body composition that want to decrease fat tissue and increase muscle mass, that's not easy to do. But one of the key things that we do in those patients that want to accomplish that is to be drinking iCell water, be drinking that every day, at least 2 to 4 liters of water with those amino acids. So one of our more popular formulations.
Are there any other supplements that you recommend that help increase longevity of different biomarkers or impact body composition?
Yeah, for sure. So iCell is probably the most impactful, but some other ones are things like alpha-ketoglutarate. Alpha-ketoglutarate is that intermediate in the Krebs cycle that helps us produce ATP, produce energy. And so alpha-ketoglutarate has a number of studies when it comes to muscle and bone. And so this is what we do in our older patients, where let's say we're doing some type of body composition scanning, and we see that they have low bone mineral content. This is one of the supplements that they add to that, because not only is it improving in muscle mass, we have the studies with muscle mass, but it also has a lot of studies when it comes to bone mineral density. So alpha-ketoglutarate is another kind of foundational one for that. a lot of the other ones, one of the main ones when it comes to weight loss that is typically always recommended with any GLP-1, most of the physicians in our network will always also prescribe, not prescribe, but supply the patient with a supplement with their GLP-1. It's called Lucinergy. And Lucinergy is an exercise mimetic. And so what it does is it mimics the same pathways that are stimulated when we exercise. So, one of the great things about GLP-1s, outside of what it does to insulin and glucose control, is its stimulation of something called AMPK, which is, that the cell's ability to recognize a deficit in energy, which improves glucose utilization. And so if you look at all the studies with things like semaglutide, all those studies were in conjunction with 90 minutes of exercise per week. And the reason that they do that is that when you can combine the actions of a GLP-1, but the actions of exercise or movement of the body, you really converge on specific pathways that have everything to do with fat oxidation and weight loss. So one of the things that a lot of our providers do is they combine it with an exercise and caloric restriction mimetic type of a compound like Lucinergy that has an impact on NAD and sirtuins and fat oxidation and mitochondrial biogenesis. And so converging on a lot of those pathways. So that one's for fat loss, for fat tissue loss. And there's another one. There's a lot of other supplements that work, indirectly. One of the things that we see a lot in physicians or help physicians with is patients that are resistant to weight loss because either gut health issues or an inflammatory state that's getting in the way of their weight loss goals. So things like butyrate and other things that work on inflammation are indirectly going to affect body composition. So it just really depends on the specific patient per se. I would say stuff like iCell water, stuff like Lucinergy, that's usually foundational, but it's in the assessment of the patient, looking at their body composition, looking at some of their other metrics, understanding their blood work, and that we can really get very precise in what other compounds or what other supplements we can utilize for that patient specifically that has something that's getting in the way of their improved metabolism.
We see so many clinics that are either just starting or they've been going for a while, but they're adding these medical weight loss medications to their clinics, and some of them support their patients with supplements, some don't, some might do nutrition or exercise. Can you speak to how important it is to perhaps do a lot of these things to support the patient during that medical weight loss process, and then maybe share any other type of, cautionary recommendations that you might have alongside of these types of things?
Sure. Yeah, we see that a lot with just the rise of these medical weight loss scenarios or even compounds that we're using when it comes to GLP-1s becoming so popular. And so many people got great at weight loss because these compounds are so powerful. But what I can tell you is if you're just doing weight loss or you're just prescribing, like a GLP-1, you really have to pivot as soon as possible over from a weight loss program to more of a body composition or longevity program. And the reason I say that is because one, for the clinical outcomes, and I'll explain that, and two, for your business. Because you're just going to, business-wise, anybody can prescribe a GLP-1, but it's really what can you combine with those GLP-1s that's really going to turn your program into body composition and longevity, which is where everybody is going. And so I would make sure or emphasize that this is something that you really need to start focusing on is what can we combine and what can we get more precise about from one patient to the next instead of just having one flat out weight loss program that everybody gets when they come in and out of the door. Now, when it comes to clinical outcomes, when it comes to something that we see a lot is a patient comes in, they lose a lot of weight. They don't necessarily exercise. They don't necessarily have the right nutrition, but because the GLP-1s are so potent and they caloric restrict so much, they do lose weight. And so in these patients, what we see a lot is a rapid weight regain or getting to a very high dose of a GLP-1 where, the appetite suppression isn't happening anymore. And the reason that this is happening is because if you're not paying attention to body composition metrics and you're not paying attention to muscle mass, what happens is the metabolism slows down a lot. And one of the things that we do in our lab is we do metabolic breath analysis. And so we measure energy expenditure or their resting metabolic rate. And so it's one thing to calculate it. It's one thing to actually measure it, because in these patients where they're losing muscle mass and they're caloric restriction, that energy expenditure goes down a lot. Now, when they get off of the GLP-1, they're burning a lot less calories at rest because we didn't pay attention to their metabolism, they're the ones most likely to have that rapid weight regain. Now, what's even more important about that is that when they go back to try to lose weight again, they don't do it as easily as they did the first time. Why? Because their energy, once you stop caloric restricting and eating again, your metabolism doesn't shoot right back up, right? It takes some time to get back to baseline. And it takes a lot of time. Sometimes it doesn't get back up there. So we're seeing a lot of patients having even more trouble losing weight the second time. And so this is why more and more people are getting educated about this, and they want a better conversation than just, what can I do to stunt my appetite? They want to know, what are the things that I can take to improve my fat loss? What are the things I can take to improve my muscle or maintain my muscle mass so my metabolism doesn't slow down? And what's the next step for me outside of weight loss? What are the things that I can start doing and looking at when it comes to blood biomarkers to prevent some of these other disease states that we have? Like, I might have a family history of cardiovascular disease that I want to really focus in on those biomarkers. I might have a history of neurodegenerative disease or dementia or Alzheimer's in my family. Well, what are the things that I can do to really focus on the prevention of that? And this is really where medicine's going. And this is, if you just have a weight loss program, this is where you kind of need to pivot and really start focusing on, because this is what is going to be, one, good for the outcomes of your patients, but not only that, two, the scalability of your business and the financial health of your business.
You talked about metabolic breath analysis, and for people who are in the medical field, is this something that's easy to add into a clinic, and what could a provider expect, or what would they need to add that in there to be able to get that information?
Sure. So there's a lot of metabolic breath analysis units now. They're more accessible than ever before. Typically, they were like kind of metabolic cards. You'd have to go to a lab or you'd have to go to a hospital to get some of this done. But now there's companies out there like Pinoy that has a mobile metabolic breath analysis unit. You can actually take it to different places if you want to. And so the RMR, which is the resting metabolic rate, is actually pretty easy. So patients come in, you put the mask on them, and they have to sit in a chair for 10 minutes, and you get their resting metabolic rate. And so if they're working with a nutritionist, that's great, because you give the nutritionist what their RMR is, how many calories they're burning at rest, and the nutritionist can get very exact on working with them from a coaching standpoint on food. The other thing that you can do is you can actually measure and identify, is my patient's energy expenditure going down? And this is what we do, is we use this information to dictate. This is what we do, but this is also what we teach physicians, is you can use this information to dictate how you pivot your treatment plan. Where if someone's energy expenditure is going down, something you want to focus on is protein and muscle, and changing towards resistance training, compounds that will help build muscle, because this is the thing that's going to increase their energy expenditure. And so this is something that you could have in your office, or you can partner up with a local CrossFit or a local gym that has a Pinoy and send your patients there, get that data so that you can utilize that yourself. Now, when you want to get more into the exercise and the performance, you do need a treadmill. Those tests will take a little bit longer, maybe 30 to 40 minutes with setup and everything like that, to get all the other biomarkers that you can get if you really want to get into the details of prescribing exercise. But an RMR, just to get metabolism, that can be done in 15, 20 minutes.
You mentioned nutrition, and I'm curious, from your perspective, outside of things like supplementation, what kind of nutrition tips or recommendations do you find are most important that you've learned along the way?
So I didn't get into the details of macros. What I've noticed is everybody's different. So I'm one of those people that I cannot sit around and track my macros, exactly how much fat, how much carbohydrates, how much protein I'm taking. Some people are. And what's great about that resting metabolic rate data is you can give that to them. And if that's the type of person that's going to follow that, more power to them. That's great. But what I've found is most patients are not going to adhere to that strict of a program. But the one macronutrient that I am focusing on is protein. Right. So when it comes to carbohydrates, some people respond poorly to carbohydrates. Some people don't. Some people do really well on ketogenic diets or low carbohydrate diets when it comes to their weight loss goals. I've realized that there's a genetic component to that because I've seen both sides of it. But what I do focus on is protein intake, because protein intake is going to do a number of things when it comes to muscle, which in this day and age, we didn't have this problem 4 years ago because we were using like growth hormone peptides for weight loss that were improving muscle mass. So this wasn't an issue. But in this day and age, with so many people taking GLP-1s, muscle mass has become such an issue. And so protein intake is the one macronutrient that I'm going to be taking a look at. I'm going to be looking at their body composition metrics and identifying, are they under muscled? Do they have enough muscle? And from there is where I want to make sure that I make that protein recommendation when it comes to how many grams of protein that they're going to be consuming. I also want to be looking at their body composition metrics when they come in later, because if they lose weight too fast and I see someone that was, had adequate muscle, now is decreasing muscle, I want to be sure to say, I want you to focus on one thing, and it's your protein intake. And these are the amount of grams that I want you to be consuming, because protein plus hydration plus all the other things, it's I find it very easy to control their body composition if we can get those two things right: hydration and protein intake, and everything else kind of falls into place.
You mentioned growth hormone peptides, and it also made me think of hormone replacement. And we find that a lot of providers are perhaps pairing some of these together. Do you see that too? And what kind of relationship do you see between these?
Sure. So, one of the best type of medical practices that, don't struggle as much when it comes to body composition are hormone replacement therapy practices, or practices that are engaging in that, because there's two hormones really that do exactly what we want when it comes to fat tissue and muscle mass. So if we're talking about body composition, so you want to be catabolic to fat tissue, and you want to be anabolic to muscle. And so two of the only hormones that do that are testosterone, that's catabolic to fat tissue, anabolic to muscle. The other one is growth hormone that has that same impact on these different tissues. Now, when you look at things like insulin, it's, anabolic to muscle, but it's also anabolic to fat, right? So that's not something that we want to be like have hyperinsulinemia. The one thing that people bypass the most is something like cortisol. Cortisol is actually doing the complete opposite. Cortisol is anabolic to fat tissue and catabolic to muscle. So you're actually going in the wrong direction. This is why stress management becomes such a big issue as well. And this is something that you need to manage as well when it comes to body composition. But yes, I find that those practices that have the ability to improve growth hormone secretion, and it's not only from a peptide, you can improve growth hormone secretion from fasting, you can improve it from how you lift weights, how you sleep. All this has an impact on the amplitude of how you secrete growth hormone. But yes, I do find that it's a lot easier for these practices to maintain those body composition metrics if they are engaged in hormone replacement therapy. Definitely makes it a lot easier.
The more I simplify what I learn in all of this experience here, working at InBody, talking to providers, I really feel like it comes down to metabolic efficiency, like you're saying, with this anabolic and catabolic relationship, and then blood sugar regulation, and finding any ways to be able to continue to support those two. Are there any other modalities of therapy that you would find synergistic in this relationship that we haven't talked about yet?
Modalities, I would say what I'm finding to have the bigger impact. One of the things that we do with medical practitioners is that we get on one-on-one phone calls with them to help them develop their protocols for their practice, and learn more about their patients and what where they're finding the resistance, or they're not getting the outcomes they want. And so what are the things that we see typically when someone's either resistant to weight loss or not getting the outcomes that they want is either in gut health or stress management, like I just mentioned being the biggest one. That if you can't control cortisol and stress management, everything else that you're doing is negating what you're attempting to accomplish. And so one of the things that I found very interesting is a lot of these devices that are like helping you sleep, like Oura Ring and things like that. But I'm finding a lot of benefit in different devices that help people with their stress management, like devices like Brain Tap that helps you meditate. Some of these even stress management massage chairs that we have in the office now. The patients there's certain patients that are like, they're just high strung. They're in stressful environments, and it isn't until we can make a difference there with them. And so there's only so many things that you can do with supplement wise or compound wise. So finding a lot of these different types of chairs, these different types of meditation apps that we can utilize, things that help people track their sleep. That's really making the big difference and turning the corner when it comes to getting the outcomes that they want.
Yeah, and part of the provider's responsibility, or I guess any health coach for that matter, would be to teach somebody how to use this and educate them on all the different components. For instance, we do a body composition test and we teach you about all these components and how they relate to your health. But the other part of that is perhaps the conversation or the coaching and the counseling that goes along with it. What's been your experience from that, or recommendations for providers to support that within their business to actually connect with the person that they have in front of them?
Yeah, it's helping them recognize the right question to ask, right? Is where we kind of go with that, where some physicians are great at that, right? They have a great personality and they're able to connect with people, while some physicians that are brilliant are brilliant at, understanding medicine and understanding why things would work and not work. And one of the key, the ways that we connect with practitioners like that is helping them understand clinically, because that's how they work. That's what they're great at, is when to identify a certain potential for resistance to the outcome that they're looking for, and what is the correct question to ask. And I would say this happens most in stress management, right? Because you can, like, a perfect example is of a patient where I would just use this example, like last weekend when I was at a conference. He got to the goal that he wanted to get to, but he was kind of like a cranky person when it comes to just your interactions with him. But he was very, very determined. Any type of macronutrient he stuck to, any type of compounds that we had, he took them on the right day. Exercise, had a spreadsheet of when he exercised, how much he exercised. And so he got to like a plateau, and we asked him, so how's life? Like, how's your stress at work? Are you in a stressful environment at work? And he said, I'm no, not really, unless somebody pisses me off. And that's like one of those responses that you're like, okay, well then if you're saying it like that, that means people piss you off a lot. And then helping that person understand and explaining to him what I just explained to you. This is what happens when someone pisses you off. Your cortisol goes up, and this is catabolic to muscle, anabolic to fat. Look at this peptide that we're utilizing. The reason that we're utilizing this peptide and it's got you as far as it's gotten you, because this is the impact it has on your tissue. Now you're taking this and you're letting this person piss you off, and it's basically deleting this and having that conversation, and it clicks in their brain right away, or they're going to change their life around to make sure that if they're putting so much effort into their health, they're not going to allow a stressful situation to negate everything else that they're doing. And so I think it's about having the conversations with the practitioners about the experiences that we've had and how to ask the right question at the right time. And I think that even if a practitioner is not that great at connecting, what they should be good at is finding either the blogs or the YouTube videos or the podcasts that explain that really well, and have a bank of information. If you feel like a patient should benefit from a specific lifestyle modification that they might not necessarily be so great in explaining, that they have a bank of information where they can lead somebody to a podcast or lead somebody to an article that they believe will make a big impact on their life. And so just being, in any business, is just the ability to be self-aware and know where your strengths and weaknesses are, and how to deal with them.
Tell me more about the cellular medicine database you've been working on, Nucleus.
Sure. So one of the things that we, our main focus in nuBioAge is helping practitioners have all the knowledge that they need to optimize their patients. And so we do that on one-on-one calls. We do that through our ecosystem of helping them understand how to use breath analysis, how to use body composition, the different compounds that are available, the different supplements that are available, what pharmacies they should be using, connecting them to basically all our connections. But one of the biggest things that we can do to help practitioners is create this, education platform that we call Nucleus. And Nucleus is where they can come. They can look at a lot of our different webinars that we've done on different compounds, or webinars that we've done on metabolic breath analysis. The other thing that we do is we bring in practitioners that are practicing longevity medicine every day. And so not only are they great teachers, but you can gain some insights for exactly what they're doing and the protocols that they're using every day, and how they're thinking through these programs. And so this is where we have the most amount of fun. Our favorite thing to do is to teach. When we can help practitioners optimize their patients, it makes an enormous impact on other people. And so this is what we do through nuBioAge. When medical practitioners register their practice, they get access to Nucleus and all the information that we have there. Not only clinical information, but also information that they can give to their patients. We also have videos on how to explain certain compounds or certain situations to patients, kind of like the ones that we're describing here today. Is how do we have this conversation with the patients? And practitioners are busy and they're running around every day and they're trying to see patients, and it's really tough for them to have some time to. Not everybody can hop on a plane and go to a conference every single weekend and learn everything that's happening out there. But that's our job. We throw conferences, we go to conferences, we get all the information that's out there and make it available to physicians on the Nucleus platform.
What else are you excited about the future of healthcare as you're going out now and you're exploring and you look into the future? What do you see that is coming, that you're excited about, that people should start to think about?
Yeah, what I'm most excited about, my initial excitement was around peptide therapy, because it kind of just changed the way I was thinking. But the more I'm engaged in this, the more I realize that it's this new wave of the future is really the clinical application of longevity medicine, right? And there's a lot of gurus out there, and there's a lot of there's a lot of information out there on what the patient can do themselves to optimize, and that's great, because that's what inspired me. That's how I got started. But what I'm really excited about is this enormous wave of really intelligent medical practitioners that want to engage in the clinical application of longevity medicine, like actually looking at the literature and mortality risk, and what can we do to help patients in their health span, their quality of life right now, but also taking a look at their lifespan and in the future. And so there's this massive wave of practitioners that are engaging in this space, which wasn't the case when I first got started. And so that's something that I'm really excited about, is bringing all the people that I've learned from in the past, like all my favorite physicians, all my favorite researchers, and starting to have these longevity events where medical practitioners can come and learn from other practitioners, and really get down to the bottom of having these discussions on how do we identify risk earlier and earlier. Because there's a lot of diagnostic companies that can look at preventing cardiovascular disease and biological age and a number of different things where we can analyze risk so much sooner. And so those are the things that got me really excited, is really the community that's being developed on, one common goal is like, how do we help patients optimize their lives? And so that's what I'm super excited about. We're going to have our first event that's the clinical application of longevity medicine. It's going to be in February 2025 in Miami. And super excited to just, get that community off the ground, and really excited to just connect with. Because sometimes medical practitioners, they're on an island by themselves trying to figure this stuff out. And it's amazing to kind of all be together and, and driving this message forward and how we're going to help all our patients out.
Anything else that you want to riff on here that we haven't talked about yet? Anything on your mind or things that you're passionate about?
Yeah, I think that, to anybody that's listening to this, it's not a medical practitioner. I think that, those of you that are doing health coaching, that are experts in exercise, I think that is one of the most underutilized and one of the most important things in healthcare. One of the things that we haven't been great at, our medical practitioners haven't been great at, is explaining to patients how powerful exercise is. I've talked about peptides, I've talked about supplements, I've talked about everything. Nothing compares to exercise. And so for everybody out there that's just an expert at helping people exercise better, helping people do resistance training, I think that you are a critical component to where healthcare is going. And one of the things that I can't wait to do and work on is, how do we combine physicians, pharmacists, and personal trainers, exercise scientists? How do we all get in the same room and actually put these programs together? Because I don't think it's going to be one person. And I think the one place where the medical community is lacking is in that expertise that, personal trainers have. And I think we got to all kind of get together in the same room and come together on how we're going to all help out, people.
Something that we've found over time is that the InBody, the body composition analyzer, has been a great tool for helping bridge that gap and create that common language among the providers, to where a gym that has it might be able to approach a doctor's office that would also benefit from this information, or a doctor may be able to go to a gym and help their patients with this information. So I really think it's a great tool to do what you're saying is needed to help unite that. Another tool that we actually just released recently is a grip strength dynamometer, and it actually integrates into the body composition analyzer, where the data can go on the same result sheet alongside of that. Is that something that you measure or have measured in the past?
We have grip strength component things here, and this is the third. I would say there's three foundational things, right? It's metabolic breath analysis, body composition, and strength. Because even more, we talked a lot about muscle mass today, but even more important than muscle mass is more muscle strength, and this is in the literature when it comes to longevity. Muscle strength is a bigger indicator than muscle mass when it comes to mortality risk. And this is the other thing that we want to be measuring in our patients is what is their strength doing throughout the treatment plan? Because if they're getting stronger and still losing a little bit of muscle mass, then, we're going in the right direction. And so, yeah, absolutely. I think that the next stage is measuring how strong your patient is. And so I'm super excited that you guys have this. And I can't wait to start using it, because muscle strength is absolutely something that's foundational to what we measure when we're initiating treatment.
The other piece of our ecosystem is a blood pressure monitor, where we're showing systolic, diastolic, mean arterial pressure, pulse rate, pulse pressure. Is that something that you measure in your practice or relates to any of what we've been talking about also?
Yeah, absolutely. So blood pressure is a key component. We've been talking about body composition and metabolic breath analysis and its integration with metabolism, right? And so outside of someone walking in and us seeing, okay, obviously, body composition metrics are off, and we know this is a risk factor for X, Y, and Z. Typically, cardiovascular disease is like the most apparent one. The next biggest thing that we focus on in longevity medicine is cardiovascular disease, because it's the number one killer. And so when we're looking at blood pressure and specific biomarkers, outside of body composition, this is like the top of what we're looking at, because cardiovascular disease happens to be that one disease state that even in our clinical guidelines, we wait way too long to start making an intervention. Like, it's something crazy, like 50% of people that are going to have a heart attack have it before the age of 60 or before the age of 50. I forget the numbers on the study. And yet we're not actually intervening till later on in life when it comes to cardiovascular disease. So absolutely looking at things like risk factors for like high blood pressure are, it's one of the key things that we do as soon as they come in is looking at blood pressure. So yeah, it seems like you guys are making everything in lockstep and key with longevity science. And I'm not sure if that's exactly like on purpose or not. It seems to be too much of a coincidence, but yes, InBody's coming up with all the major components of what you would need for a longevity assessment.
Yeah, when you talk about cardiovascular disease, it makes me think of something I learned, where the plaque in your mouth is very similar and related to the plaque that's in your arteries. So you could actually get the measurements in your mouth to determine if you're going to have plaque in your arteries downstream, to help even prevent that disease risk state from happening. And to your comment, I guess, about our ecosystem, one of the things about the grip strength dynamometer that we like to share is the body composition analyzer is a great way to show us the quantity of muscle that you have. And the grip strength dynamometer is going to show us the quality of that strength. So it takes it another step further to be able to see that. And if anybody's listening and you're interested in learning more about our ecosystem and getting started, you can go to a special landing page we have for nuBioAge. It's learn.inbodyusa.com/NUBIOAGE. And a member of our team will reach out and give you a special offer there. And then for anybody that wants to connect with you, Leonard, we will put the link for nuBioAge on our site. And then do you have anywhere else you'd like to send people to connect with you?
That's the best place to connect is on nuBioAge. If you're a medical practitioner, if you register your practice, you can have access to all of our education, plus events, plus supplements. And yeah, that's the best place. Once you're in that ecosystem, once you get in that email, then you can have access to everything else that's part of that ecosystem on how we help patients.
Well, thank you so much for joining me today. This was a lot of great information, and I'm excited to share it with everybody soon.